Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 28th of September. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Thank you, Sophie.
In the United States yesterday, we saw 41,000 positive new cases. That's like the lowest number I think I've said, Dr. Murphy, in a very long time. Our current 7-day average is about 51,000 positive new cases with a 21% decrease over the last 7 days. And this number is only decreasing, fortunately. Hospitalizations have decreased by 15%, and the death rate in the United States has decreased by 4%. In Illinois, we also saw 1,762 positive new cases yesterday, with an average of roughly 2,300 cases per day, with a 14% decrease. Hospitalization and the death rate in Illinois are both decreasing in the mid-20s, which is awesome, in the mid-20%, which is awesome. Okay. All the numbers are so positive, Dr. Murphy. What should we make of this? Should we be believing these numbers? What do you think?
Well, numbers are numbers, and we should believe them because they've been collecting them the same way for a long time. And so we can have faith in these numbers, and we should be reassured that things are getting better. We're still not there, and we have to be vigilant. And if you've noticed, there's been no new variants that have come out since the BA4 and 5 earlier this year. So that's why these numbers are going down, excuse me, in conjunction with the large number of people who are vaccinated now and getting boosters, and now the new booster, which will work even better. So all of it is just really good. It's not over. We can't, if you give up too soon, you immediately slide backwards. But we're so close. We need to just keep pushing and promoting the vaccines, because basically what the public health people have, the authorities have given up on other mitigation efforts. They want people back in school. They want people back at work, in the office. They want people back on the public transportation. They want people out socializing and freely mixing, which is, for the most part, is happening. Although the workplace is still, in Chicago anyway, the office occupancy with people in them is like in the 40% range, but that's up from 10%. So, that also is going in the right direction. But, I think the world is going to be a different place when we do get out of this thing altogether. I mean, people have realized that, do you really need to be sitting in an office 8 hours a day, 5 days a week, or whatever your schedule is? So overall, very good. And it's good to see that the hospitalization rate is going down. And this is for a couple reasons. One is that the case rate is going down, but also the use of Paxlovid is pretty good. So remember, if you're eligible for Paxlovid, you're 50 and older, you have any underlying disease whatsoever, even if you're as young as 12, you can get Paxlovid. And that's another, and it doesn't matter whether you've been vaccinated or had COVID in the past, none of that makes any difference. It's an antiviral drug that works really well for COVID. So, you take the Paxlovid, or if another drug comes out, you take that. But it's all this is working together. So, it's everything is hand in hand. So what we've evolved to is from social mitigations and masking to immunizations with vaccines and prior and disease and treatment if you do get it. So, that is where we're going, and that's going to be the way it is for quite a while. And we've got to just keep our eye on if there are any new variants out there that can beat this BA4 and 5.
Perfect. And, this goes right into our next big headline, which is that Pfizer is seeking to expand the Omicron booster to 5 to 11-year-olds, which should hopefully also help bring these numbers down and down and down.
Yeah, so the kids are under vaccinated. Parents have not jumped into this with both feet. They should, because it's a pool of at-risk people. And so the uptake in the kids is not very high. But we have to immunize everybody. So everyone's either going to keep getting COVID or you're going to get vaccinated and get COVID less. And so this is a good sign. Moderna also has plans to get down to 5 years of age. They've already down to 12. So, it's important that the whole you can't leave big chunks of the population unvaccinated, because that's just going to kind of start the whole thing over again.
Yeah, no, absolutely. And while we've been talking about so many positive things, unfortunately now this second big headline that we have is that the CDC no longer recommends universal masking in health facilities. What does this mean for the future of healthcare facilities such as hospitals, etc.?
Well, this is a kind of a surprise. That doesn't mean you're not going to have to wear a mask when you are in a hospital setting. And it depends where you are in the hospital. Remember, hospitals are very different places. It's like all the patients are basically immunocompromised. Otherwise, you're not going to be in the hospital. So there's a lot of risk in hospitals. You have to be very careful. I think maybe in some of the common areas, you won't have to wear a mask, but this is going to be up to the hospital. And I'm not sure what each hospital is going to do. But the local hospital can decide, as long as the case rates are not high risk. So if the case rates pop up, the mask mandate will come back in healthcare facilities. So it's up to the hospitals now.
Wonderful. And our last big headline that covers the monkeypox conversation is that monkeypox appears to be decreasing, but the risk and uncertainties are still lingering in the population. So what can you tell us about what's going on with monkeypox as of now?
Yeah, so monkeypox is still a big problem worldwide, but the cases never got that high. They didn't really jump out of the high risk group that they were originally in. And they are coming down now. Now, remember, when monkeypox was a well-known entity, there already was a treatment. There already was a vaccine. The vaccines are out. They're more and more available now. It looks like that you don't have good protection unless you have both shots. So for those people that had one shot, make sure you get your second shot, because the one shot is not all that protective. But this is not a surprise, because contact transmission is relatively difficult. You have to physically touch somebody and get infected, or touch a contaminated towel or sheet or something like that. So it's the worst is respiratory transmission, because you're just breathing in the air and people are picking it up. So contact transmission is much harder to transmit. And then just with being careful with who you touch and whatever actually stops the spread right there. So, just knowing about the disease helps considerably, plus the vaccine and the treatment. So that little blip will be going down. It's going to be interesting to see if we can eradicate monkeypox, get it down to basically zero, which is what it was, but it was always endemic in Africa. So the question is, will it become endemic outside of Africa? So that's the big question. We have to watch that.
Yeah, absolutely. Okay, Dr. Murphy, going into our COVID questions. The first one is rather long, so bear with me. This individual says that they are 72 years old and they've had Moderna vaccines, one in February of 2021 and the second dose in March of 2021, then late October of 2021, and got their first booster. They did not get their second booster because they actually got COVID and took Paxlovid, and they were in quarantine for 5 days, etc. So they had COVID in August of 2022, and they got their booster in late October of 2021. So when should they be getting their new booster shot / their second booster shot, being that they're 72 years old and have had COVID recently?
Yeah. So this person had one booster, so that's great. And then they got COVID in just August, so last month. So 4 to 6 weeks ago, most likely. And now they're up for the new vaccine, the bivalent vaccine, which is a great idea. This person needs it. And the question is when? You can actually officially take it as soon as you feel well. But after you've had COVID and this person's already received 3 vaccines, they're fairly immunized anyway. There's a lot of side effects if you take it too early. So my recommendation is to wait 2 to 3 months and then take it. So what this person could do now is they could take the flu shot now, protect themselves from the flu for this winter. The new flu shots are available for people who are 72 years old. It's highly recommended. And then wait until November. So, 3 months after the recent COVID experience, and then get your new bivalent booster shot in November. That would be my recommendation. But you could take it at any time from now to then. But I think to avoid more severe side effects, I would wait a little bit.
And then Dr. Murphy, although this question isn't being asked, I think it's a question that people ask all of the time, which is what vaccine should they be getting? If they did the Moderna sequence, should they get Pfizer? If they did the Pfizer sequence, should they get Moderna? The information is rather unclear. What can you tell us about what vaccine is best to get right now?
Basically, the Moderna and the Pfizer and the Novavax is available too, but I don't think I'm not sure. I don't know as much about the Novavax, but we're learning more about it. It is approved. There's not much difference between the two. There is a little difference. And they've looked at the responses when people switch back and forth. And the responses actually were a little bit better if you switched, because the vaccines are slightly different. Whether that translates into less hospitalizations or less death or anything is very hard to calculate, but looking at the blood tests that measure the efficacy, mixing and matching can be better. So, for instance, if you start with one, say you've had all Pfizer shots and then you're up for the new one, I'd say get the Moderna one. And vice versa, if you had all Moderna shots, I would say now get the Pfizer one. If you've mixed and matched already, it doesn't really make any difference. And it doesn't really make too much difference anyway, because they're both good and they're both proven to be effective, and you don't have to mix and match. And it's kind of up to people right now. But the mixing and matching is not bad, and maybe a little better.
Wonderful. And our second question ties right into this, but with a little bit of a caveat. This couple 70 years old, and their initial vaccine was J&J, and their first booster was Moderna. So should they get Pfizer? Dr. Murphy, what do you think after getting J&J?
Yeah, so the Johnson & Johnson vaccine, although it's not used much anymore, is a really good vaccine. For a single shot, it's the best. But then this person got the Moderna, and now they're up for this new bivalent vaccine. I mean, if you have the option, I would say get the Moderna one. And then you'd had all 3 vaccines. You have, you even have a broader exposure to the antigens, and you're making an immunologic response against more parts of the virus itself. So, but it's, again, I would just say don't take the J&J again, but you could take the Pfizer again, but I think I would prefer the Moderna myself.
Wonderful. Well, Dr. Murphy, those were all of our COVID questions for today. We will see you next week.
We'll see you next week. Thank you.